in private hospitals. We have the latest update on that story from Laura Otieno, who's live from Kisumu. Laura, good morning. It's good to see you. What is the way forward on this stalemate now?
Trevor, there is no end in sight for this particular stalemate because, as you have indeed maintained, we're waiting to see who will blink first in the combat between the county health workers and the county government, because last week we saw the county government through its Ministry of Health releasing a letter, or rather a warning letter to the striking workers, indicating that firm action will be taken against them for failing to report to duty. We have seen the governor in several instances indicating that he does not really understand why the health workers have refused to resume duty, because it says that the crisis that he had earlier on matters of payment was due to the stalemate between the national government and the Senate on matters of revenue allocation. But then, since that matter was resolved, the county government has insisted that it has paid some of the workers, and of course it has insisted that it was in the process of paying a number of the 2,000 workers. But then the various unions that encompass the Kisumu health fraternity have indicated that the payments have been made in part, and therefore that is breach to some of the terms that they had agreed on their return to work formula, which they had signed with the county government. So right now we are at the entrance of the Kisumu County Hospital, which is basically one of the public facilities within Kisumu town. The situation is indeed dire. We have seen empty beds. We have seen people walking out of the hospital basically because they have not found any service been given at this particular hospital. It is a similar situation replicated across all public hospitals across the county, and we have seen an influx of people going to private facilities. But then remember, Trevor, this is one of the counties that was selected to pilot the UHC cover, and so most of the residents were banking on that particular card, that UHC card, to access medical services. But then for the past 3 months, the situation has been very different, because health workers have decided to stay off duty, and of course now we are waiting to see between the health workers and the county government now whether the county government will be taking stern action, because we have seen also the county government sometime earlier this year indicating that it will be hiring nurses and doctors on locum after there was a strike by the nurses and doctors in this particular county. So of course we are waiting to see what will happen. And remember, KMPDU had also indicated that it's about time. They had sent a petition to Parliament indicating that health function perhaps should be reverted to the national government. So of course those are some of the questions that we are seeking to answer, and of course we will be looking at the report perhaps that Kisumu County will be submitting at the end of the UHC pilot phase, considering that it has faced total paralysis in the health sector for up to 3 months, and yet it is one of the counties that is supposed to offer a benchmark environment for the national rollout of UHC. So of course later on we'll also be speaking to the various unions on exactly the way forward, because some of them have received payment, others have not received payment, and hospitals such as Jaramogi Oginga Odinga Referral Hospital, which is the largest referral hospital in this particular region, has resorted to using its privately contracted doctors, as we saw during the Awasi accident here in Kisumu. The doctors that were attending to patients at the referral hospital were doctors that were under a private contract. So of course we are waiting to see what will happen between the county government and the county health workers to see who will be blinking first in the ongoing combat that has caused total paralysis in the health sector here in Kisumu, Trevor.
Laura, Siaya is just 66 kilometers away from Kisumu. That's about an hour, 20 minutes drive. Is that an option for the patients there, and is that the closest county they can go to?
Well, indeed, Trevor, not only Siaya, but some of the residents have been traveling to Kakamega, because Kakamega is about 45 minutes from Kisumu. So some of them have been opting to seek services from the neighboring counties, including Kakamega. Siaya, of course, is an option for most of the people who come from that particular area but live within Kisumu town. So, but then remember, Trevor, Kisumu was ranked to have a poverty index of about 37%. Therefore, it is a stretch for some people to even be traveling. Remember, when the UHC came, most of them saw it as a reprieve, that their health woes would have been solved. So of course, even getting the fare to travel to the neighboring counties to access healthcare for those who cannot afford healthcare in private facilities is quite a stretch. We have seen a number of patients whom we have been speaking to in the course of this strike, indicating that most of them are just now staying at home, most of them opting to use painkillers as they wait for that stalemate to be resolved. Some of the worst affected include patients who are dependent on the dialysis machines at the Jaramogi Oginga Odinga Teaching and Referral Hospitals. There have been a number of people who have been forced to stay home with fractures and other injuries which could have been managed at dispensaries and level 2 hospitals, but then going to those places there have been no services that are being offered. And of course, we'll also be looking to examine the angle of pregnant mothers as well as children or babies who are coming in to receive immunization on what exactly their options are, because remember, also we're having this conversation in the wake of the malaria vaccine being rolled out. So of course, those are some of the questions that we will also be looking to answer in terms of the health crisis that has engulfed Kisumu County, Trevor.